Hello and welcome to Global Healthcast, brought to you by Global Health Press. Once a week, we cover for you news on infectious diseases, vaccines, and vaccination. Today is Tuesday, October 18th. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, good evening, everyone, depending on where you are at the moment.
This is our next edition, and today we exclusively talk about COVID, monkeypox, and adverse events and side effects, and we have some important news for you. And I guess, Melvin, it's the weekly update on where are we globally with COVID.
Yes, we have been doing this for 17 weeks now. Like what we do every week, we start with this quick global COVID epi update. This is from the WHO COVID situation report. And again, as we say every week, this is not real time. This is a week late. And keep in mind that countries don't test as much now as compared to several months ago. So globally, the number of new weekly cases decreased by 10% as compared to the previous week. The number of new weekly deaths remained stable as compared to the previous week, and this is around 9,000 fatalities. If you go to the next slide, you will see the new weekly hospitalizations in some countries in Europe. And although we are not where we are as compared to a year ago, it is clear that COVID-19 is still not over, and we are unfortunately seeing indicators rising again in Europe, suggesting that another wave of infections has begun. And if you go to the next slide, this is showing us the vaccine doses administered per 100 people in the world. And at least 218 countries and territories now have administered more than 12.8 billion doses of a COVID vaccine since the first COVID case was reported in China. And 2.68 million doses are administered each day. So there are several different vaccines that have been developed, as you all know. However, only 23% of people in low-income countries have received at least one dose. So, we have already manufactured almost 13 billion doses. And if only these 13 billion doses were used properly, right? So in the next slide, you will see the different countries and the number of vaccine doses they have administered. You will see on top is Cuba. And Cuba is interesting because it actually produces its own vaccines. They export their vaccines as well to some countries, and they have the highest vaccine coverage ratios in the world. When it comes to the pandemic outcomes, they also have the best outcomes. And Cuba is currently the most vaccinated developing country in the world, and it is different from other countries because they have two homegrown vaccines. And what's different as compared to other countries, I would say, is that they have a 3-dose protocol. So unlike most countries that have a 2-dose protocol as vaccination and you have a booster dose, their protocol actually is 3 doses. And that's what they considered fully vaccinated in Cuba. And I think that's it for this slide.
That's very interesting. And just for the interpretation, this is doses per 100 people. And Cuba has 374 doses per 100 persons. So that means that most people received more than 3 doses, right? Some people have received 3 only, but some 74 of 100 have received 4 doses already.
Yes.
That is unbelievable. And what I also like to point out, look, Cuba and Chile are not the richest countries in the world, and they have high coverage.
Yep.
Singapore is a well-to-do country. China is, I guess, I'm not sure where to put it. I mean, if you go to a big city, it is a well-developed country. If you go to the countryside, it's probably not, but pretty good with 200 per 100. Brazil, an emerging country, right? Emerging markets, 2 doses per person. This is already something. United States, not even 2 doses. Then again, poor countries down here. So this is really very impressive, Melvin. This is thanks for sharing this data. This is really interesting information. Yeah. I go to the next slide, okay?
Yep.
Monkeypox.
Ah, this is our epi curve for monkeypox. So cases have declined since their peak in early August, and we are now in, I would say, the best case scenario, I would say. And we can attribute the success to changes in behavior among those at risk for monkeypox and quick uptake of monkeypox vaccines. But a growing evidence suggests that another factor is also helping slow down the outbreak, and this is the fact that the virus can spread only under very particular circumstances. Remember, early on in the pandemic, people were saying that monkeypox might be like COVID, that it can be transmitted by symptomatic people, or other theories. And basically, it's not what happened. And I think in the next couple of global health casts, we can stop talking about monkeypox, right, Professor?
Yeah, I agree. It gets a little bit boring if you see numbers going down, right? Then there is lack of interest, and we don't want to bore anybody. So, yeah, but that's very interesting. It's very good news, and I'm very happy about it that that numbers are really going down. That's very good news. Thanks for sharing, Melvin. You have one more topic, which is SARS-CoV-2 reinfection and imprinting, and explain us what you mean with imprinting.
Well, imprinting is, a lot of people have been saying that infection with COVID or vaccination with COVID might actually increase reinfection. And that is one of the theories that people are saying. And that's one of the arguments actually of the anti-vax people, right? That, vaccine might actually cause that. And this data from Qatar, this is actually quite new. This was only released a few days ago. It shows that Omicron COVID infection induces strong protection against a subsequent Omicron infection. And an additional earlier infection with a non-Omicron SARS-CoV-2 strengthens this protection and even broadens the immune response versus a subsequent reinfection challenge. So it's basically telling us that what they were theorizing is not happening.
So basically, if you received the vaccine, if you're double primed, versus if you had the disease, then the protection is lower with the disease primed people versus the vaccine primed people.
Mm-hmm.
That is the message, right?
Yep.
So get the vaccine, right? And don't
Yes.
wait for the disease to come. It's of your disadvantage. So this
Which
is an
which we
important
have been
information.
saying since December
Yeah.
2020.
I remember all your funnies and your slides on get the shot, right?
Yep.
Very nice information. Thanks for sharing. It is very reassuring that this is biological plausibility, by the way. That's what you would assume, but it's even better to have the data then. Very nice. Very good. Melvin, you have some more good news on dengue vaccines.
Yes. So the Committee for Medicinal Products for Human Use, or the CHMP of the EMA, or the European Medicines Agency, recommended the approval of Takeda's dengue vaccine candidate, TAC-003, for the prevention of dengue disease caused by any serotype in individuals 4 years of age and older in Europe, for the travelers, and in dengue endemic countries. So this is really good news, especially because for this vaccine, you don't need to test for serostatus to see whether you have been infected in the past or not before you get the vaccine.
And that was the case for Dengvaxia, the previously licensed dengue vaccine, right? So there is a difference between the products. That's what we'll point out, right?
Yep.
Yeah. And we do have sort of a target profile here. Now that the vaccine is licensed, it's no longer a target profile, but as it is here, this seems to be the profile. I have not seen the APA yet, but maybe you can briefly mention the indication for the new vaccine.
Yes, so this is for 4 years old and above, and this is for, of course, people living in endemic countries, and for Europeans who are traveling to these endemic countries.
Yeah. And I guess the important sentence in the licensing or in the what do you call in the opinion of the CHMP is that it should be used in accordance with official recommendations. And but look, it's very nice and it is an efficacious vaccine. So it is not yet marketed because for marketing it needs the signature of the European Council of the European government, basically, right? They have to sign it, which is a formality. I would not remember one instance where the CHMP opinion was not approved or signed by the European Commission. So it's a question of time. It will come
Mhm.
very, very soon.
Yep.
Very good. Very interesting. Good news. Melvin, post-COVID. My God, what is this?
Yeah, so I just wanted to share this one because I thought this is really interesting. This is from the WHO Regional Office for Europe. They created this fact sheet, which is very informative, clear, and easy to understand. Basically, what it's trying to say is that while most people who got COVID fully recover, it is estimated that 10 to 20% go on to develop what is now known as long COVID. And what they are trying to emphasize here is that rehabilitation, recognition, and research, these are three important things needed for people living with long COVID. And I think if you want to know more about long COVID, please go to this site and read more information about it.
Yeah, thanks for picking that up. This is WHO information, so it's trusted information available around the globe. And yeah, very, very nice. Thanks for showing this. A very important topic these days. And you have one more on COVID. What is this about?
Yes, so I think this is just interesting. It is a study showing that 4 out of 10 Americans said that they were often less than truthful about whether they had COVID-19 or they didn't comply with many of the public health measures during the height of the pandemic. And this was a nationwide study. And I hope to see similar studies from other countries because I'm sure it's not just the Americans who really were not quite honest about their COVID status or were not complying with the public health measures. And I am not sure I've seen similar studies from other countries, but I would like to see similar studies.
Yeah. So I guess some people are split in their mind, right? They say something different from, yeah, they are lying basically. That's the message here, right? They are lying about their COVID status and about COVID news.
The other thing that I wanted to point out is just basically in the study, it showed that all age groups younger than 60 years and those who had greater distrust of science were more likely to engage in not being truthful. However, the researchers found no association between COVID-19 misrepresentation and political beliefs, political party, or religion, which is sort of different from what we showed in a previous Global Health Cast, where we showed that in counties that are more Republican leaning, there were more deaths.
Yeah, that was that was the data we presented last week. Very interesting piece, public health issue. So thanks for sharing. I have one topic only today, and I only have very few slides on that. I think it's only 2 slides. And the one is side effects. There are 4 types of side effects caused by vaccines. The first one is reactogenicity. So locally, you may have a swollen red arm and it may be tender and painful. You may have a general reaction like fever, myalgia, you don't feel well, whatever. You have general symptoms. That is called reactogenicity. And reactogenicity does not last longer than 2 days. That's it. Then there is anaphylactic shock, which is quite rare. From an old study, we know this is roughly 1 per 500,000. It may happen with any dose, even with the first dose. If you have had contact to the antigen before, it may happen. And it is so rare, but still physicians who or people who vaccinators must be ready to treat anaphylaxis at any time. This happens usually within 15 to 30 minutes after vaccine administration. So that is why there is a recommendation that you should stay in the vaccinator's office for up to half an hour, depending on country. Number three, technical errors. The most common is people mix up the vaccine. So instead of measles, mumps, rubella, you receive varicella vaccine. That is a technical error. Very rare, but still possible. There may be a problem with the vaccine. These days, this is very unlikely because of all the testing procedures before a vaccine can reach the market. So technical error it is very common when it comes to this mixing up vaccines. It is very rare, if ever, occurring these days with our modern vaccines and with all the testing procedures that we have in place. What people worry about is vaccine-specific side effects. And that is, for example, Guillain-Barré syndrome after influenza vaccination, one per million, roughly, in one season that was observed. So this is very, very, very rare, but it may happen. There is not many of these vaccine-specific side effects, and I will cover that in another global health cast. But this is what people worry about, particularly when it comes to COVID vaccines. And this is why I want to explain the difference between adverse event and side effect. And that's on the next slide. Adverse event is anything that happens after vaccination. Melvin is a nice guy and he is my friend. So if Melvin gives me my 5th dose of COVID-19 vaccines and I die when I step out of his private practice, then the question is, was it the vaccine why I died, or why did I die? So my death may be related to vaccination, it may be unrelated, or you simply don't have enough information to decide if it is related or unrelated. Still, in all countries that I know about, adverse events, if they are serious or severe, have to be reported to authorities. Again, adverse event is anything you don't like that happens after vaccination. In contrast, side effects are all adverse events that are caused by a vaccine. So we know the vaccine is causing things. So if you have received your influenza shot and 5 days later you have Guillain-Barré syndrome, you can reasonably assume this Guillain-Barré syndrome may occur without vaccination, and by chance you were just vaccinated, but at the same time, it appears more likely, or there is a good chance that it was caused by the vaccine. So adverse event is anything that happens, causality unknown, side effects only if it is linked causally to the vaccine. Now, to find out, you need to do causality assessment. And there are criteria if an adverse event was causing a side effect or not. And these criteria are, for example, biological plausibility, timing of events, specificity, clinical studies. So there are different types of data you can use for your causality assessment. Now, let's say Guillain-Barré syndrome after influenza vaccination. Usually Guillain-Barré syndrome occurs in people 18 above with a frequency in the Western world of roughly 1 per 100,000 per year. So this is the natural occurrence of influenza of GBS, right? It's very difficult in a single case to find out if the influenza vaccination caused Guillain-Barré syndrome. Now, the issue is really with all these coincidence or causality issues, due to the beta error, you can never exclude causality. Let's say Guillain-Barré syndrome is 1 per 100,000, you give the vaccine and you don't find it. Then, you may say, okay, Guillain-Barré syndrome is so rare, it only occurs 1 in a million. And you will not, if you do a study then with 1 million subjects, you still will not find it by chance or whatever. So you need to do a study with 10 million. But then you can say, well, it is so rare, it is only caused 1 per 100 million. And this is endless. Basically, the story is with observational study, you can never exclude anything for the beta error. a nice saying would be, if you don't find your car key, it doesn't mean it had disappeared from the globe, right? You simply did not find it. So the beta error is an important reason why we can never claim safety. We can never prove a vaccine is 100% safe. What we can say so is that with all the data we have, a vaccine has an excellent or a good or an acceptable safety profile, which means this is all the adverse event. We don't know what is causal and we don't know what is just by chance, but we have an overall profile of the vaccine, and the safety profile of vaccines, that is in the label. So you don't see people get this wrong all the time. They mix up adverse event and the safety profile with side effects. In the label, you have a safety profile, and it even gives you the data on the frequency of adverse event. 1 per 1,000, 1 per 100,000, 1 per whatever. You see the frequency. And then what you can do is you can do a benefit risk assessment. You can say, in the initial days, dying from COVID was 1 per 100 to 1 per 1,000, and getting the vaccine, severe adverse event, would be 1 per 10,000. So I get the vaccine, right? I don't want to die or come up with any other complication. So the benefit risk assessment, that is the important point, and the safety profile. And I hope as of now, you know to distinguish between adverse event and side effects. For COVID vaccines, the major adverse events that are listed in the package inserts are coagulation diseases, CNS diseases like Guillain-Barré syndrome, nervous system involvement like facial paralysis, myocarditis, or facial paralysis. And again, it is listed in the label how frequent it is. And now you have to make a decision. Do you want to have the disease with all the complications, including long COVID? Or do you want to get vaccinated with a vaccine that has this safety profile? Melvin, I hope it was not too complicated. Do you have any questions?
No, I think it's clear. I like it that you placed myocarditis here because it's one of the things that you can see in anti-vax messaging, right? And I think most people do not understand that myocarditis that we are talking about here, this one that is related to COVID vaccines, they resolve on their own. And so far, there
Yeah,
have been zero reports of these people with COVID vaccine induced myocarditis who died.
yeah,
However, for people who had COVID, not the vaccine, they die from other heart diseases, including myocarditis. So I think, like what you said, it's really a benefit risk assessment of what do you want. Do you want
yeah,
myocarditis from the vaccine, or do you want the myocarditis or death from the COVID?
yeah. And again, the important issue that I cannot stress frequently enough is that adverse events are not side effects. And what you see on the label and on the package inserts is not side effects, but adverse events. And what is left out in the package insert, because this is an individual task, which is benefit risk assessment. If you have rheumatoid arthritis, you take steroids and tons of other medications, your risk of disease is different than for a 18-year-old young army person, right? They have a different assessment of risks and benefit. But even if I were an army recruit, I still, as Melvin pointed out, would look at myocarditis after COVID and myocarditis after vaccination. There is a difference there, right? So I think this is all about vaccines and adverse events. Melvin, this was fun today. Thank you for your input and thanks for your contribution today. I enjoyed it very much. Uh, any last word from your side?
Just get vaccinated and get boosted. I think that's what we need to stress.
Yeah. Thank you very much. And we have heard today COVID-19 epi update numbers are going up in Europe, down globally. COVID-19 vaccination update, we gave you that there is good coverage, and we gave you Cuba as an outstanding example. Monkeypox is about to disappear, I hope. We talked about imprinting by COVID and imprinting by COVID vaccination, and you're better protected if you've had the vaccine. We told you that there is a new dengue vaccine out there that received a positive opinion, not yet marketing authorization by the CHMP. Melvin presented to you the WHO poster on post-COVID. Please download if you want to get more information. He told you about COVID lies, and I explained at length the difference between adverse event and side effects. No funny today. I hope it was funny anyway. Thanks for joining us. I am Joe Schmitt. Goodbye and have a great day.
Thank you, everyone. Stay safe. Get boosted.